Welcome to Prime Time, a show for adults in the prime of life. I'm Susan Hoskins, the director of the Princeton Senior Resource Center. We do programs and services for older adults, their families, and caregivers. I'm happy to have as my guest today Barb Bristow from Senior Care Management, and we're going to be talking about care management and home care. Welcome, Barbara.
Thank you, Susan.
Now I know that you're also a social worker, so you come to this from a social work background and you've been in the business for a while.
That's right. In fact, we're celebrating our 20th anniversary this year.
Oh, hallelujah. That's great.
Thank you.
So why don't we start off by talking about what we mean when we talk about geriatric care management. Sometimes people get confused and when they think care manager, they think, oh, that's a state caseworker for children. So let's start. What's a geriatric care manager?
Well, let me just say, I am a member of the National Association of Professional Geriatric Care Managers. So we define care managers and care management as professionals, usually licensed clinical social workers, registered nurses, psychologists, people that are licensed to practice at the independent level.
Okay. And if someone wanted to engage the services of a geriatric care manager, how would they find someone who's certified through the national organization?
I would suggest going to the website of the National Association of Professional Care Managers, and that website is njgcm.org.
People can call us at the Princeton Senior Resource Center and we'll make those connections for you for either Senior Care Management or the New Jersey Association or the National Association. I know that one of the times that I recommend to families that they engage a care manager is when the family member that they're concerned about doesn't live nearby. So for example, my husband's family parents live in Oregon. It's hard for us to get from New Jersey to Oregon to help them out. When somebody ends up in the hospital, should we go, shouldn't we go, what happened? And having a geriatric care manager who knows them, who knows how well they do when they're doing well as knows the services in the area is a great way to have eyes and ears on the ground.
That's right. Long-distance caregivers are often the people that are contacting us as a care manager, the adult children. And, unfortunately, there's usually a precipitating event, a hospitalization, an automobile accident, a visit home, and then the adult child will contact us for services. And I think a care manager can really help adult children because we can do things so much more efficiently. It takes a lot of time to fly back and forth or drive back and forth. We know the resources in the community. We can sit down with the older adult and the family member and really, map out a plan and a strategy.
I know that, again, using my in-laws as an example, there was a call one day. My father-in-law was in the hospital. It looked like it was heart problems. And so the siblings started calling back and forth, all of whom live out of state. Who's going to go? What are we going to respond? Somebody's got to be there. And then a couple hours later, the doctor was able to extract the information that my father-in-law had left his heart medication at the summer cottage and was figuring he'd go back down next weekend and get it. But his congestive heart didn't agree.
Yeah.
But within a couple of hours, they had him on IV and he was back to himself, and none of us needed to go. But it was helpful to have someone there who could talk with the doctor, who could reassure my mother-in-law and be with her, and just get through all of that. But it wasn't the same kind of emergency where one of us needed to go and be there for weeks.
Right. The ideal situation as a care manager is to have at least one of the adult children, or as many as can come, to initial meeting where we can sit down with the older adult and really have a family-style meeting around the dining room table and lay out the issues and lay out everyone's concerns, because then it all gets expressed, and then we can come up with some strategies about how to make things better and alleviate, the concerns that the adult children have.
So the way that you start, and sometimes the concern comes from an adult child, sometimes it's a person who's planning ahead for themselves, right? Who says, you know, I know
the former more than the latter,
yeah,
I'm afraid,
yeah.
but we do have some people that
So
are.
what you do first is you meet with people and...
Yes, and you know, preferably, I think all care managers would agree, we'd like to meet in the older adult's home if that's possible, just because a picture's worth 1,000 words. Sometimes it's a place they're more comfortable.
Sometimes they're not able to leave very easily.
You know, that too. Having said that, we have had some adult children that are very nervous about approaching their parents about this issue, and they may want to come to our office and kind of have a pre-assessment meeting. Just, you know, learn a little bit more about us, get a little comfort level, talk about what strategy they think might be most, you know, appealing to their parent. But, you know, it's best if we can come into the home and have as many involved family members there as possible.
I've also had the experience where some older adults don't want to burden their children or don't feel comfortable talking with their children about their care, and working with a professional helps
And, you know,
them kind of take it out of the family dynamic. There's so many things that happen in 20, 30, 40, 50, 70 years of history between parents and children.
And that is a good point, and I think that's another reason to have a professional care manager, because you can go in the room, you can sense that, and we often end up, you know, kind of spending some time with the older adult in private, spending some time with the kids in private, and then coming back together and really trying to lay things out in a palatable way to everybody. You know, when we come and do an assessment, we're really looking at the functional status of the older adult. What can they do? What can't they do? And this can be ADLs, cooking, grooming.
Define ADLs, because
activities of daily living. You know, the grooming, the cooking, the laundry. Then we're also looking at executive function, writing checks, driving, you know, organizing a household. So we're kind of trying to get a real idea of how that older adult functions within their environment and where they could use a little support, because everybody wants to stay home.
Right.
And in most cases it's possible. It's just tweaking things a little bit to make that happen.
I think it's important also to reassure people that you and we are trying to help people stay in their own homes as long as that's safe and possible, and that we're also trying to help people use the abilities that they have and get help where they need help.
Right.
Because it's not an on-off switch. People don't lose all function. And sometimes we forget, or sometimes adult children who are eager to help, or they see one thing going wrong, think, oh, Dad can't drive anymore and can't do any of the business, the check writing, any of the business, and they kind of take everything away.
Right, right.
And so your role is also to help people really see what's not working and what is working.
And this is why a care manager can be helpful, or an outside objective professional, because really I feel a lot of our work is helping the two generations negotiate, you know. I mean, the adult children always want more help, you know, the older adult always wants less help. And we kind of negotiate something that everybody can live with, and it's a starting point, you know. Often, you know, an adult child will want to have a home health aide 7 days a week, and the older adult will say, well, I can maybe tolerate somebody in my house 2 or 3 days a week. So we start out with 3 days a week. So most times a relationship develops, and then we can expand from there.
Right. And oftentimes, you don't need somebody.
Right, right.
For 8 hours a day, 7 days a week.
Right, it would be overkill.
So it's important to assess that. Now, I think one of the other concerns that some people have that I've talked to is, well, so does this mean that I have to see you every week? Are you going to be calling and checking up or stopping by my house? You know, this is my castle, this is my space.
In terms of the care
how
manager?
About the follow-up? Yeah.
The care manager?
How does it go after the initial assessment?
Right. Okay, so we talk about the initial assessment. We get everybody's buy-in on a care plan, the services that we're going to bring into the home or connect the older adult with. And that's a critical part, because what we'll talk about there in that care plan is the frequency of a visit and how much, you know, attention do you need. And, you know, I would say to be a care manager, truthfully, if you're going to be effective, you've got to see the person at least twice a month. 2 or 3 times a month. Because a part of it is developing a relationship and knowing that person's routines and
Right.
preferences. And with less contact than that, it's really hard to do that. But this is why a care plan is so important, because you're really negotiating out all of these terms, so to speak, and that becomes the plan for going forward.
It brings to mind something that I was very aware of when I was working as a therapist, that it really helped. Usually when people came to see me, it was in a crisis, when they were at their worst.
Right.
And it really helped to know somebody long enough that I saw them functioning at their best, because then I knew that's what they were capable of. And I think, again, if you engage a geriatric care manager before there's a crisis, and you get to know the family at their best, then you also know what they're capable of and the stand that you're trying to maintain.
I mean, and that's certainly the ideal. The other thing that we go through in our assessment is looking at legal documents and really making sure that people have power of attorneys, understanding durable power of attorney, having advance directives, and really talking to their kids about what their wishes are. I mean, I think that's the best gift an older parent can give their children.
We've been talking a lot in my caregiver groups recently, and I don't want to get off on too much of a tangent, but we've been talking a lot about caregiver ethical dilemmas, and not just the end-of-life decision-making, but that when the person you're caring for has dementia, can't make decisions for themselves, you have to make a lot of decisions along the way. Do you want to be home? Do you want to be someplace else? If you get sick, how aggressively do you want us to treat that? The classic that we start off talking about is, if my father has dementia, should we treat for prostate cancer or skin cancer, something which is not as likely to be a terminal disease.
Right.
And the caregivers have to make those kinds of decisions. And so having those conversations is so important.
Yeah.
We'll do another show sometime on how to talk with your parents and how to talk with your children.
And you know what? No matter how much planning you do, it's hard. It's hard. That's the nature of it. But it's less hard if you know the desires and the preferences of your family member.
So coming back to care management, are there fees that go along, and how do the fees work?
Yes. I mean, unfortunately for private care management, there is no compensation, federal or state, so it is all privately paid for. And fees in our area, the East Coast, I would say run between $100 and $200 an hour, depending, which, sounds significant, but if you're having to buy a plane ticket, or having to take time off work, and there's a lot of work up front in terms of care management, getting to know the family members, setting the services up, making the connections, making sure that the older adult's comfortable, with the services and what you're introducing. But once, you get things set up, you can be pretty efficient in terms of use of your time. And I think for families that are at long distance or have a lot of demands, raising children, working, it's something that's well worth it.
Well, I think the piece, too, that is really invaluable, I'll use my in-laws as an example. I got to Oregon. We knew my father-in-law shouldn't be driving, just figuring out what transportation services are available, what other services. Is there a meal service here? Where's the nutrition program? I know there's a nutrition program in every county, but where is it here?
You can really spin your wheels, and it's very time consuming, and a care manager can cut through all of that.
Knowing, okay, so I found 6 home care agencies. How do I know which ones are reputable? How do I, and I know from working with you and other care managers that you all have firsthand knowledge through your clients and through your networks.
Right. And we
are know what's going to be the best match.
Right, and we are in and out of facilities seeing clients all the time, so we know the hospitals, we know the rehab centers, we know the nursing facilities.
So let's talk a little bit more about that too. Beyond the assessment and hooking people up with services, so hooking up people up with services are things like home care services, meals perhaps, transportation, those
Right.
kinds of things that we do in Partners in Caring and you do in your with your care managed clients. Do you also accompany people to appointments if they can't get there themselves?
Yes.
'Cause that's something we don't do.
Yes.
You know, it's one of the things I use as sort of a dividing line. This is
Right.
you should go to a geriatric care manager if you need 24/7 contact, if you need that
Right.
personal accompaniment.
A big part of our practice is accompanying patients to the physician's office, because if there's, and everybody gets nervous when they go to the doctor, and if you have a little bit of a memory impairment on top of that, it can be very difficult.
And then your daughter says, "So what did the doctor say?"
Right. Yeah. I mean, I go with my husband and he's fine. It's just often helpful to have, you know, another set of ears. So we always accompany our clients to the doctor's office, and, you know, we're following up on recommendations. We're reviewing what issues or symptoms they might be having that they want to discuss with the physician before we get to the doctor's office, so we can really make, you know, maximum use of that 15, 20 minutes you have. And then following up, you know, there are often tests that have to be, you know, referrals have to be made, medications that have to be picked up. So we coordinate all of that.
That's great. So I know that one of the services that a lot of people connect with is home care.
Yes.
And your organization is a little unique in that you also have home care providers. You're a licensed home care provider.
Right.
So let's talk a little bit about what home care is
and you know,
how to choose home care.
Sure. And I have to say, we incorporated home care into our services because almost everybody we were maintaining at home had home health aid for some portion of a day or a week. And we decided to bring it under our auspice because we wanted to have more control over the home health aides and what their duties were. So that's why we started a second agency.
Best way to guarantee quality.
Exactly, exactly. And so we've been doing home care maybe for 16 years now. And we are, as you mentioned, a licensed healthcare services firm with the state of New Jersey. And you can go on the web. The Department of Consumer Affairs licenses these agencies. And, you know, there's always a big discussion, and I'm sure this is part of where you're going, whether I should hire a home care worker privately or I should go through an agency. And, you know, full disclosure, I have an agency. But I think you have to really be prepared to do a lot of groundwork and to be very involved if you hire somebody privately. And my whole thought about home care and having a home health aide is that it's to ease caregiver responsibilities, and when you hire directly, you're taking on an additional burden, and you should just know that, you know, from the beginning. And some people, that's their preference. You know, they really want to be in charge and want to, you know, monitor this and be closely supervising the situation.
Right. Well, we were talking a minute ago about that challenge of being your own care coordinator, you know, or care coordinating for your family member, that to figure out where do I get the meals and where, you know, plus there's 8 different doctors to go to, plus
it's a full plate. So to add
right, and then
the supervision
to
of a home health aide
the home health aide is similar in a way that you're never off duty.
Right, right.
And when you hire privately, I know you're responsible for hiring, for paying taxes, for screening the person, and for any training that needs to happen.
And I think, you know, one of the other things that is really difficult is that you're really stuck in the position of negotiating with someone, meaning the home health aide, who you are very dependent on. You know, so you've got to talk about pay. You know, if they're doing something that you're unhappy about, you have to talk about the delivery of their care. You know, they have family concerns. They might, you know, have health issues, and, you know, you get involved with that too. With an agency, you have an intermediary, and agencies have rules, and there's a reason for those rules. They're to protect the worker, and they're to protect the client. So if there's something that you're unhappy about, you can complain to the nurse of the agency, who will then pick it up with the home health aide in a tactful way.
Well, even that too. There is a nurse at the agency
Yes.
who can do
If it's a
home
licensed
visits,
healthcare
right?
services firm, you're required to have all certified home health aides supervised by a nurse. And that is an added feature. That's wrapped into the fee that you're charged for the aid. And you have access to a nurse, I'd say once a month to every other month, depending on the frequency of the home health aide. There's a home visit done by that aide to see if anything's changed with the patient, to see how the aide and the patient are interacting, to find out if you as a family member have any concerns.
Does that nurse also set up meds?
Yes, almost everybody, that would be an additional fee because you can't kind of coordinate it, and the medication piece gets very
But I
complicated.
think people are sometimes surprised that the home health aides can't set up meds or
Yes.
give people meds,
Yes.
whether they're privately or
The home health
hired
aide,
through an agency, that an aide can't give medication.
right,
And yet that's one of the things that is often pretty high on the list of things that are needed, that the older adult can't keep track of what's the morning meds, the afternoon meds, the
Right.
middle of the afternoon meds.
you have to have a license as a nurse to pour medications. That means taking the medication out of the pill box, putting it into, out of the vial, into the pill box or into a cup, whatever the system may be. That's a licensed function of a registered nurse. So I guess in some cases, some licensed practical nurses can do it as well. But a home health aide would be violating her license and could lose her license if she were to pour medications. That doesn't mean, however, that she can't remind the older adult, she can't take the vial or take the pill box to the older adult, point what to take. So they can assist, remind, they just can't pour.
Yeah. I think one of the other things that you haven't mentioned that I'm thinking of is that when you go through an agency, if your home health aide is sick one day or has a family emergency, the agency also has an obligation to have somebody there. And so if, let's say, you're living with your parent and you go off to work every day, but you count on that companion or home health aide to come in while you're at work, it's pretty important to have somebody show up.
Yeah, and that's an additional stress you bear if you're hiring somebody privately. The scheduling piece is enormous for home health aides. Many things happen in their lives too. And, in private cases I've heard where, Ethel will send her cousin Dorothy, but Dorothy might not be licensed. Dorothy doesn't know, the client. So that can create other problems too.
So, I've known families who were very happy with their private hired people, and people who sort of became a member of the family and stayed for years and years.
Right.
And it's wonderful, and we're encouraged by those stories. So
and I'm
people
not
need to
saying
make
that
a
it can't
decision.
work. It's just you have to be aware of the responsibilities you're taking on to make it work.
Well, you put out a newsletter periodically, and I know that one of the newsletters that you wrote was on that decision making of whether to hire privately or use an agency. Take a minute also to talk about the difference between a home health aide and a companion.
A home health aide has had 72 hours of training, and it has to do with direct care of a patient. A companion has no training. There's no training required. Home health aide has an actual license similar to a nurse. The home health aide has to be supervised by a nurse. That's a requirement. Companion can be supervised or not supervised. I think that there's definitely a role for both types of employees. A companion can do things such as, run errands, cook a meal, do laundry, do housekeeping, and there is a real benefit to that.
So at some point in the journey, that may be what's needed.
Right.
May be adequate, but then at some point later on, you may need to add an additional level of care.
And we decided to go with licensed certified home health aides because they can do all those companion things, but then they can also give a bath, help somebody get up and out of bed, assist with PT exercises.
So you wouldn't need to get used to a new person if
Dress,
those needs
exactly.
changed.
And you know, it is all, in this business, when it's most successful, it's all about the relationship and the rapport.
Right.
And it's a very sad thing to have to say, I'm sorry, but you can't have this worker anymore because they don't have the proper training to take care of what your needs are now.
Right. And that's why it's so important, I think, to have someone like a geriatric care manager, because you also create continuity between the levels of care. When a person's living independently at home, if they go into a hospital, then into a rehab, then come home, you can oversee those transitions. If they go from home into a residential care facility, you maintain a relationship as an advocate, as a friend.
And I want to say, too, there's no blueprint to this. Every family and every older adult is different. There are many people that we have maintained at home for 10 years. And year 11 comes, and you know what? Home just isn't meeting their needs anymore. They're not that happy there. You know, placement might be a better option. You know, there are other people that stay home until hospice comes in and they die at home. Home isn't necessarily always the best situation.
So one of the keys to care management is the flexibility and individualizing a plan.
Right, right.
Barbara, this has been wonderful. Thank you so much, because I think that so many of the folks that we work with who choose to stay at home or at any point in this journey do use home care, do need some kind of assistance, and I think you've helped outline some of the key questions to ask and services that are available. So thank you for being my guest.
Well, thank you, Susan. And I just want to mention also that we have a website, and we have a lot of this information, especially in our newsletter section on the website, and that's seniorcaremgt.com.
Great.
Thank you.
We'll post that. Thank you very much.